This program has reported on many occasions the lack of facilities in Canberra for people with an acute mental illness. Now we can finally bring you some good news. Today, a new centre opened which should address some of those concerns, and it can accommodate 40 people at a time. Adam Shirley had a tour with the Executive Director of Mental Health Services.
This is the hub of the building. This is the socialisation spine. It's where the consumers will be spending the majority of their day, either between here and the therapy wing. The choice that we have in this unit for the consumers is something that they were very strong in their feedback and the consultations that we had. They wanted the option of being able to use group tables. They wanted separate tables. They said that they wanted the option of having comfortable chairs, upright chairs. And so we've really in our design picked up on that. The admission to this unit is based on a psychiatric assessment. Our consultant psychiatrists' assessment guides whether people are admitted or not admitted. When a person is acutely unwell or there are really high concerns for their safety, for their risk, we will admit them for that short period of time with the intention of them then moving back into the community with the supports around them.
But what if someone's in a crisis situation, they don't have time for an assessment? Can they come here for some support?
They can always come here. If somebody is that desperate, they can always come here. Whether we continue to manage them here is another question. We have a community-based crisis assessment team and we would call them very quickly. We are also on the Canberra Hospital campus where the emergency department and our mental health assessment unit is part of this campus. So yes, if they turned up to our front doors, we would say come in and then we would help them to get to the most appropriate part in our system. Recovery is not a one point in time, it's a journey for people. When they are really acutely unwell, this is the right place for them, and we've designed it that way. Recovery then continues for when people are discharged from here and out into the community teams.
This place can accommodate 40 people. Where until now have those people been going?
The inpatient stays have been happening at our psychiatric services unit here on the hospital. There's a 30-bed unit here on the hospital campus that we will be closing when this one is opened, and the people that are currently admitted will be moving across into this unit, and then new admissions will happen from here. This is one of the typical rooms in our low dependency area. As you can see, they're all single rooms. Everybody has their own privacy.
The design of the furniture and the room as well, it's pretty sparse, it's fairly stripped back. What's the theory?
It's sparse at the moment because we haven't filled it with stuff, so that there will be more soft furnishings in the rooms when the unit is commissioned. But we have given a lot of consideration to the design of the beds, the tables, so that they are safe. This is a what's termed a short stay unit, and so that is about 2 weeks in duration. That's the average length of stay that we have. Some people need to be here for a little bit longer, and some people a little bit shorter, but on average 2 or 3 weeks. People actually do better in their own homes, when they're in their own community, when they have their family and their carers around them.
We're not too far from the front entrance of the building. What is this section used for, Tina?
We're just walking into the high dependency area of the unit. We've got 10 bedrooms in this area where people, when they're really acutely unwell, the staffing ratios are higher in here. There will be more nursing staff to patients in here, which is really important for people when they're acutely unwell. When people are in this area, it's usually for a short period of time, and then they move back out into the low dependency area and then into the therapy program, but the active group work doesn't actually occur in this area. We're hoping that this gives people a respectful, a dignified place in which to spend their acute phase of their mental illness so that they can start their recovery journey and stabilise.